Back to Tuesday's Midday. Dr. Aaron Matthews is joining us now. It's great to have you with us.
Awesome. Thank you so much for having me.
Absolutely. So first off, talk to us a little bit about your role over at the VA.
Perfect. I am the Chief of Mental Health Nursing. So I have all the clinics, the outpatient clinics, the acute care setting, and I lead the nurses in their practice as we take care of everybody that has diagnosis ranging from PTSD to homelessness to substance abuse disorders, or just people that come to us in crisis that need some help through whatever's affecting them at the moment.
Absolutely. So talk about the role of these mental health nurses overall.
Absolutely. Primarily what our outpatient nurses do is what we call care management, case management.
Okay.
So they'll do the triage when the patients initially come into the clinic from either a primary care provider or from an ER or some source in the community. They get them keyed up, they ask them several questions, they kind of get a sense of where they are, and then they help prepare them for their first appointments with either their psychiatrist or their therapist, whoever that may be. And then a lot of what they do is follow up after that. So it's not always the psychiatrist that has the time to call them and make sure the meds are working. It is quite often our RNs that will reach out to these patients, make sure they're dealing with whatever stressors in the moment might be affecting them, they're getting enough sleep, they provide education on healthy meal options and food options that would affect their overall whole health.
Absolutely. So they do a lot, basically.
Absolutely.
All right. And so just talk about, just mental health with veterans in general, too.
Well, a report that came out in 2018 of VA Mental Health Services indicated that over 28% of our beneficiaries have some sort of mental health diagnosis.
Okay.
And we've been trying to create access as we go through this. And nurses are integral to this. Again, like I said, we do those triages. We do a lot of these intakes. We help get people to the right person at the right time. And as we're trying to create access to take care of our veterans, we start finding unique needs specific kind of to nursing. One of the big ones that has been developing over time, unfortunately, has been the impact of substance use disorders on our veteran population. Right. And so we've developed some teams, and we work hand in hand within our multidisciplinary teams to provide the care that the veterans need so we can address those issues.
Right.
One thing that I did want to bring up is I did want to kind of describe how we've expanded our substance use disorders here in Alexandria.
Okay.
We've hired 2 new providers. We were working out of Dr. Danielle Newman was doing awesome with our intensive outpatient program and our substance use disorder clinic, but we had a little bit of a gap when it came to providing medications for like opioid use disorder. Okay. So we've hired 2 new providers, Dr. Jeff Seabrack and Dr. Cheryl Smith, and along with them we also hired a specific nurse case manager, and they've been doing a lot to provide that access that we absolutely need to these veterans and help them get the care that they need so they can function at the top of their abilities. They have whole health.
Absolutely. And so we're almost out of time, but for anyone that wants any more information, how can they find out?
We are available through va.gov. You can treat with you can chat online automatically with somebody to get you pointed in the right direction.
Okay.
We also have administrators on duty during business hours, Monday through Friday at our clinic. They're more than welcome to come in. We'd love to see you in person, shake your hand, and hear your stories.
Absolutely. Dr. Matthews, thanks so much for being with us.
Awesome. Mahalo. Thanks for having me.
And we'll be back right after this break.